free drugs, free prescription drugs. That sped up the demise and the bankruptcy of Medicare by several years. Medicare is going bankrupt without this health care plan. The reason it's going bankrupt is simple demographics. There used to be 7 workers for every retiree. Now there's 1 worker for every retiree. The demographics are not out there for you guys. When you're going to be paying all these taxes, but the only way it works is either we default on these systems, give people less, or we raise your taxes dramatically. The systems are going bankrupt. But then our leaders in Washington say, oh, well, here's this moderate plan by Baucus, $874 billion. But they tell you in the next breath, they say, oh, but it's really not going to add anything to the deficit. It's kind of hard to believe that they're going to have an $800 billion plan that's not really going to cost anything. And when's the last time a government program ever came in under budget? The Medicare prescription drug plan was going to cost $400 billion. It's over $1 trillion now. Government routinely does not make good estimates, maybe not even good faith estimates, and the costs explode. Why do the costs of government programs explode? Because they take away the consumer having to pay for the product, and it gets overused. So you can't predict how much it will be used. Once something becomes free, everybody uses it. If we say, well, these are criticisms of Obama's plan, what's your answer? I think there are answers where we bring capitalism into it. For example, I think we need to make health insurance more like term life insurance. I told you before, if I have a heart attack tonight, but I survive, they'll triple my rates because I have a 1-year health insurance plan. But I also have term life insurance, and it's very cheap to have term life insurance. And if I have a heart attack tonight, but I survive, my term life insurance doesn't go up because I have a 20-year contract. The ideal type of insurance you need is, and what true insurance is insurance against unusual events. It's not prepaying for your health care, it's having insurance against having an automobile accident or cancer or having some serious illness that is very expensive. But what would happen in the free market is you have much higher deductibles. You might start even as a 20-year-old with a $2,000 deductible. But if you don't spend it, you might go to a $4,000 deductible the next year. The higher your deductible, the lower your premium. So instead of having $1,000 a month premium, maybe you have $1,000 a year or $800 a year premium, but you pay when you go to the doctor. People say, I don't want to pay $150 when I go to the doctor. The trade-off is, if you paid when you went to the doctor, we would get rid of all price controls, even for Medicare. So let's say the Medicare deductible were $2,000. Everybody would pay, but all of the charges that I charge under $2,000 wouldn't be fixed by government anymore. We just throw them out there. So there's 10 eye surgeons here in town. They could charge whatever rate they wanted to, and competition works. Those who are younger, don't have as big a practice, may charge a little less. Or those who just want to see more patients may charge less. That's the way the marketplace works. We don't have a marketplace in healthcare. So you have to get to the fundamental question, and I think they're completely missing that in Washington. Their whole answer is just a new government program, which they say will be free, but there's nothing free. If you want to look at what single payer or universal health care looks like, look to England and look to Canada. At Canada, at any one point in time, there are 1 million people on the waiting list for health care. There are small towns in Canada where they have a lottery to see who gets to see the family doctor. If you're early in the lottery, it might be 6 months. If you're late in the lottery, it could be 3 years. People wait. And they also, in the end, don't have enough money. We already don't have enough money in Medicare, so they end up having cost controls, or what we like to call, or what we call, I think more accurately, rationing. And so what happens, for example, in England, there's a commission called the NICE Commission, and they've decided in the last 6 months of your life, you're worth $26,000. If your chemotherapy costs $50,000, you're out of luck. The government then puts a value on your life as opposed to the individual making that decision with their doctor. You have to ask which direction you go. If you want it to be free and you want everybody to have it, you then have to ask yourself, does free work, and is it really free? You're going to pay taxes. They pay much higher taxes in Canada and much higher taxes in Europe to have these programs. But the question is, what gets the most health care for the most people? I would argue that capitalism in the marketplace distributes goods much better than government can. If you want to think about how government can distribute things, Think about FEMA. Think about Katrina. Think about distribution of water bottles at the Superdome and how it was a disaster. How they sent trailers down there that were never used and are still rotting in Arkansas. How people in jail in Baton Rouge applied for FEMA money saying they were dislocated and they'd been in jail the whole time and they got FEMA money. The bigger government gets and the farther away it is from you locally, the more corruption, the less oversight, the less efficient, and the more waste. You need it to be more local. And people say, well, capitalism is not going to take care of the poor. Well, we do already have programs that take care of the poor. But also we should do it through charity. We have a program in my office called the Lion's Eye Clinic, and we take care of people who are actually not poor enough to be in Medicaid, but are the working poor, and we take care of them. Programs like that will happen. We're an incredibly wealthy country, and I think the goods are distributed better if we do it through the marketplace. I hope you'll think about that as this debate goes forward. And at this time, I'd like to thank Dr. Ardrey again for inviting me, and I'd like to open it up to questions.